أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم أشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله. Dear esteemed viewers, Assalamu alaikum wa rahmatullahi wa barakatuhu. Once again, you're most welcome to this program, Health Check, a program which is intended to bring to you some of the health issues or discussions, and it is a program which touches our souls, because these are the things that we always go through. Health problems, everyone has a different health problems, but when we come here we tend to discuss them and we see how we can go about them, or how we can live them, how we can prevent them, or even the treatment. In this program, I am privileged to have a doctor in this another episode of Health Check, Dr. Akatulinda Bakari. You're most welcome, Doctor, for this another program. And before we continue, can you also say something to our viewers?
Yeah, thank you so much. Good evening, viewers, and I'm happy that you are watching us. We believe that in these programs of Health Check, you will pick something that will better your life, that will better your health, because that's why MT Africa decided to bring us always on board to discuss with you, share our knowledge with you, because shared knowledge betters a lot. Shared knowledge helps a lot. So I'm here to share with you a few things here and there, and appreciate you for watching us.
Thank you so much, Doctor, for this program. Thank you for coming. And today, let us talk about osteogenesis imperfecta. It's a very technical term.
Yes.
And if you're not serious, or if you don't manage your tongue very well, you may find yourself unable to pass it on your tongue. Osteogenesis imperfecta. I don't know what is it all about, but with you in the studio, we shall have a very deep understanding of the term, or even the problem itself.
Yes.
So what is osteogenesis imperfecta?
Thank you so much. I will break it down. I will make it simple for us to understand it. Osteogenesis simply means the stages of development and maturation of bones.
Of bones?
Yes, our bones.
Okay.
Now, imperfecta, it means something not perfectly made, or does not take the perfect route, the perfect paths it's supposed to take. And therefore, osteogenesis imperfecta is the condition where the bones don't develop as they should normally do, as they are supposed to normally develop. Therefore, there is a default in the gene responsible for the development of the bone. And thus, this condition is there. It is there. And many people look at it and perhaps call it, if in Africa, they may call it witchcraft, they may call it what, but it is simply a condition called osteogenesis imperfecta. Okay. So it happens, and it is important for us to dive into it today, discuss it, and we have a clue about it. Yes, so it is very important for us to know it and always look away, have a look at it, and be on the lookout for it. In case it happens to people whom we know what it is and how to go about it.
Okay.
Yes.
When bones are growing, that is the osteogenesis.
Yes.
The
imperfecta.
The initial stage of the development of bones.
Yes.
And then the imperfecta, when the bones actually fail
to move in the normal stages of growth.
Normal stages.
Yes.
So does this mean that a child will be born just like that without bones, or what do you mean?
Thank you. They will be born they will have bones, but the bones will not be as normal as they're supposed to be. They don't have the constituents or the components of a normal bone as they're supposed to be. Normally, a bone should be strong enough, but these might not be strong, or they might be curved. Sometimes you can see people with curved spines on the back. A person has something on the back like a hump or something, and the bones grow in an abnormal way because of the malformations in the development. And so they will have bones, but with those abnormalities.
Okay.
They may have easy fractures.
Okay.
As
so
a sign.
they're always very weak.
Yes, very weak, yes.
So what are some of the causes and the risk factors? Because as parents out
Yes.
there, they need this.
True.
Because it is something that is so scary. Giving birth to a child who is very weak, who is having a hump at the back.
Yes.
It's so scary. So what are some of the causes?
Yes, now the causes specifically are not known because, like I always say, there are some diseases which are not caused by a certain bacteria or microorganism that will go and eliminate this.
Okay.
Now, this just happens when there is a problem in the genes responsible for the manufacture and growth of the bone. So we can't say it's caused by this, but it is a genetic disease.
Okay.
It can move in families. If a person has had it in their family, then the person has high chances of producing a baby or a child, or a child with a disease, with a condition. So it is very scary, yes, but it moves in the genes. It is rarely caused by external factors. This is purely internal factors, the genetic makeup. Yes.
Can I have some genes of this disease even when you see me normal? And when I give birth to a child, the child tends to be very weak and having this problem. Is there that scenario?
It may be possible, but usually those with this gene, usually their bones do not grow well. Okay. So it is a challenge. This type is a challenging one, that once you have that problem, it is rare not to express it.
Okay.
Yes.
Okay. So what are some of the complications that this disease, this problem comes with in a child? Yes, he is very weak, he has this problem, but then are there some other things that follow this problem of osteogenesis imperfecta?
This disease, one, because of the improper growth of the bones, they tend to have fractures easily. A fracture means the breakage of a bone. So they are easily fractured because the bones are not strong enough.
They're very weak.
They are very weak. They can easily fracture. That can be a challenge in the daily lives of the child. And also, most of these children, they have issues with hearing. They have hearing impairment.
Okay.
Although we have not established the relationship between the bones and the hearing, but most of these children who have this osteogenesis imperfecta, they usually have challenges with their hearing capabilities. So it becomes a challenge with them. And therefore, it even affects their development mentally, let me say so, and socially. For example, in school, they may not be able to perform well because of their failure to hear properly when the teacher is teaching in the class. So it becomes an associated factor, or which you can call a complication. Then also some of these children don't last long. They die because of that challenges. Some of them may take like 10 years, 20, but they later die. So it becomes a challenge. I can't also fail to mention this, that most of them, they have weak immunity.
Okay.
Because there are some white blood cells are manufactured in the bones. Due to this type now, when a person has challenges with bone formation, they have less white blood cells, and therefore they have less immunity. So a child will not grow as a normal child growing, and they have those challenges resulting from this osteogenesis imperfecta.
Okay.
Yes.
I wanted to ask about the symptoms, but as if there are no symptoms, because if you say that it is just something that you can just see, that a child is born, It's just there very weak, it's not growing very well. It's as if also the symptoms you've explained, unless there is any other symptom for this problem.
You will notice a child as they grow, the age of hearing reaches, the age of responding, they're not responding well.
Okay.
They have retarded mental development, and you can easily tell there's a problem. And then, you know, kids can play a lot. They easily have fractures, and you wonder what the cause is. Now,
a small fall down, the child will break.
Has broken the arm.
Okay.
Has broken the leg, and you can easily suspect there is an imperfection in the growth of the bone.
Okay.
And then you immediately rush to hospital, and they test to see how the bones are.
Okay.
Yes.
There is also a scenario, I don't know if this is also part of the problem, or also part of the disease, whereby you will find a child is born, but one leg is not in the same size of another. Is that also due to this problem? Or?
Okay, that one may not necessarily be caused by this, because this osteogenesis imperfecta, the gene responsible for the development of all bones is affected, and therefore they are normal length and the size of the bone, but the strength of the bone is compromised, is lacking, is minimal. Okay. And therefore it may not have irregular legs, irregular bones, bones of irregular sizes. They may be irregular size, but not strong as normal bones are supposed to be strong. And in that case, a person needs to think twice. The child may be having osteogenesis imperfecta. Yes.
So it's also a very dangerous one.
Yeah.
And painful, because you'll be there, then the child is out of the bruise. The child's arm is broken. Or,
yes.
Can we treat this?
Yes, we can try, because we can give medicines to help strengthen the bones.
Okay.
Like I always say, once you diagnose it early, we can give medicine to go and supplement on the hardening of the bones. So this one we have good news that we can manage this, we can handle.
Okay.
Only that we call upon each one of us to monitor their children. In case they see these signs, take them to hospital. The doctors can diagnose, and they see how to manage, how to give the treatment, the drugs for this.
I used to hear that when women are pregnant and they sleep so much, there's a high chance of giving birth to a child who is very weak. Is it true also? And can also that child be termed as having this problem of osteogenesis imperfecta or imperfection of the bones? And is it true that when a woman is pregnant and sleeps a lot, so much, there's a high chance of giving birth to a child who is extremely weak?
These are called myths and misconceptions around our health, especially here in developing countries. It is absolutely not true that the way a woman rests too much when she's pregnant will make the child also weak.
Very weak.
Leave alone bring this issue in the bone development. Not really. This is purely an issue of genes, not the woman's behavior or sleeping or not sleeping or activity. No, this is purely genes. So it cannot affect. Those are just myths and misconceptions which have been proven to be untrue. So none should rely on them, but we should just make sure we observe our children well. In the case of not such a thing, we just rush to hospital and doctors can advise us.
Doctor, you mean that when a woman is pregnant, there is no way can help the infant who is still in the womb to make sure this infant is produced when he's very strong in the bones? Is that there is no any contribution for that?
Oh yeah.
Is it specifically for the? Is this problem specifically for the genes?
Oh yeah, it is we encourage mothers who are pregnant to eat foods rich in calcium to encourage bone development in their children. We encourage them to eat greens to make their children to have healthy and strong immunity. We encourage them to take their folic acid tablets to get blood and all those things. But dear viewer, I want to let you categorically understand this condition is caused by an abnormality in the gene responsible for the collagen or the strengthening of the bones. And therefore, it does not matter whether you took foods rich in calcium, whether you cared for your pregnancy well. No. This is purely a gene issue.
It's a fate, it must come true.
If it is to happen, it happens. And so what we do...
There's no escape.
There's no way of escape. If it is to happen, it happens. There's no can prevent by eating foods or what? No.
Because it is in genes.
Yes. We can strengthen the bones of our children normally, like I mentioned, by eating good foods, calcium, foods rich in calcium, eating liver, eating what, eating greens. But for this condition specifically, if it is to happen, even if we eat all those things, it will happen because it is a genetic issue. It is in genes, not external factors. Feeding, what? Not really.
So, doctor, you mentioned about a child who is having a hump at the back. Isn't there any way we can remove that? Because it looks so awkward. And the experts of the medical experts have gone so far of operations. So there is no way we can operate such a problem. Person who is having a hump at the back. In terms of treatment.
Yes, orthopedic surgeons can help on it. Actually, I mentioned the hump on the back to explain. A person can have anywhere a bone which has grown abnormally.
There are some who have
on the chest.
On the chest,
yes, on the chest, on the back, everywhere. So in such cases, you take the child to hospital. The orthopedic surgeons can advise. Actually, I don't know, but orthopedic surgeons, they can operate what you call plastic surgery, and they make the place, the area straight. They try to cosmetically make the child get back to normal, the part to get back to normal. Although it might be costly, but I'm sure it can be worked on. Only, like I mentioned always, let's try to do these things early. Not wait when a child is 30 years, 40 years.
So you mean this hump can be seen at the early stage?
Yes, you can notice it early, yes. Actually, even a young child, you can easily see something here on the chest or on the back. You say, skin is not normal.
Okay.
It's better take that child at that age to hospital for the orthopedic surgeons to work on the child early enough than wait for the person first to grow and be a big boy, a big man, then to go to hospital.
Okay.
But orthopedic surgeons can work on it, and they can at least help to make the child look nice, look better cosmetically.
So, doctor, what can be our contribution? Because if you said that this is something we cannot do, I mean, there is nothing we can disturb or interrupt the process of it to occur. You mean there is no any other way we can come in to solve this problem? Because you say that it is genetic.
Genetic, yes. Dear viewer, the reason for this show is definitely to educate you on how to go about these diseases. Among the preventive measures of each disease that we shall share about is always early detection and management. So here, in this condition specifically, it is genetic in nature. So we shall not know genes. But what we do is to observe an infant, a baby who is born, and observe them during their development stages. Then if we notice, then we handle early enough. In doing so, because we mentioned and said, this condition will disturb or will impair the growth of the child in the future. For example, a person having a hump on the back, they look ugly like that. So early enough, we can take to hospital and they do some surgery to aid life, to relieve, to make life better, and the child can grow at least better than they are. I mentioned hearing problems.
No.
So in that case, then you take your child to the specialists in hearing. Then they look at a way of helping your child early enough. All these things now, which we can't trace the cause to remove it. Now we go to when it has happened, how do we intervene early enough to stop the consequences and the complications of the disease or the condition. So here is early detection and management is the way to go.
Thank you so much, Doctor. Our esteemed viewers out there who have just joined us, this is a program, Health Check. We are discussing today osteogenesis imperfection, and the doctor has explained this very well, that this is a scenario whereby in the process of the development of bones, there is a scenario whereby bones do not grow perfectly, and a child is born just like that, very weak, and can easily even be they can get broken very easily. Yes. And I think this is what we always see in our societies, because I believe that everyone sees such people or such children in the societies where they live. Now, Doctor,
yes.
Let me also mention this as a question.
Yes.
I don't know if it is also related to this problem, whereby a child is born lame. One leg is not working, cannot
well.
be pressed on the ground firmly. Is it also because of this problem?
Now, lameness, or a person can be born with the arm facing the other side, or leg facing this side, or those are called congenital abnormalities, which happen in the formation of the child's organs or the formation of the bones, a malformation. But now here in this osteogenesis imperfecta is when all bones are in their normal shape, in their normal sizes, in their normal places where they're supposed to be. Normal tendons, normal ligaments, normal joints. But simply the strengthening of the bones is limited because of the difficulty in the formation of them by the gene. So the gene responsible for that, other genes are all available and doing their job. One for the size, for the address, because in the development of a child in the womb, there are very many processes, very many genes responsible for putting eyes, putting the skull, putting this, putting
thousands of them.
Thousands and thousands doing several jobs, several tasks. So in this case, it's only the gene responsible for strengthening of bones, which is absent or incompetent, let me say so. Let me put in layman's language. This gene is incompetent, only that gene for strengthening the bone. But other genes are all normal. So in this case, a child is not born lame, is born very fine, but the strength of the bone is the challenge.
Okay.
Yes.
Thank you so much, Doctor. Unless there is anything that we've not talked about, but I would like to call this program to an end.
Perhaps to emphasize that early detection saves a lot.
Okay.
Early detection, this time I won't tell you to prevent it, because it is genetically
it's out of our control.
Yes, out of our control. Allah decides.
Okay.
But if it has happened, then let us observe it, diagnose it early, and get a way of handling it early. All other factors associated with it, the hearing impairment and what, we can handle them individually when they are still in a lower or less severe stages. So I can say, dear viewer, for this one, I won't say prevent because you can't prevent, but if it happens, please try to intervene early enough to prevent further complications resulting from this osteogenesis imperfecta.
Thank you so much, Dr. Akatulinda Bakari. Thank you so much. Thanks for sharing with us such a very wonderful information. which everyone needs it to have in their mind. Such problems occur, and there are also others, just like this one, we cannot have any control over them. But for those which we have control, as the doctor is always mentioning, that let us try to prevent. But as for this one, let us be keen. When a child is born, let us give that child a very close eye on them or on that child, whereby we manage we look at how the child grows. If there is any imperfections in the growth of the child, whereby maybe the child finds themselves getting broken easily, these are some of the signs which the doctor has just mentioned. There are so many problems relating to this, where the child will have very many problems. So let us make sure that we give the child a very close eye. Thank you so much, doctor.
Thank you.
And I would like to end this program here. In case of any question concerning health issues, the doctors are everywhere. The doctors are everywhere. You can ask any doctor in your locality, and they will be able to guide you. With this program, we cannot exhaust each and everything. We only give you just a little within the 30 minutes we have here. Let us meet next time, inshallah. I am Swagude Twahil Twalha. Assalamu alaikum wa rahmatullahi wa barakatuh.